Hello everyone and welcome. This isn't my typical video. I wanted to make a video today because I have read an article the other day about how far research has come as far as treating different types of cancers. And of all the cancers that were listed in this particular article, the one that they said receives the least research money and where deaths have increased over the last 20 years is endometrial cancer or uterine cancer. And so far as of today, I'm a survivor of endometrial cancer, and I wanted to share my story and to hopefully help other people who might be going through this be aware of some of the signs, some of what you need to recognize, and what to do if you find yourself in that situation. So in November of 2019, on Thanksgiving Day, I noticed that I had some irregular bleeding. And, I'm of the age where I'm at the age for menopause, but I wasn't 100% sure if I had been completely finished or what the story was. So I didn't really think too much about it. And then every so many weeks after, I would experience the same thing. And I was like, well, I guess, I haven't hit there yet. Until one day, it just didn't stop. And I don't want to say that the bleeding was just horrific, because it wasn't. It was, I guess, pretty normal for most women if they're going through their cycle. However, the fact that it just didn't end and that I was having these really horrible stomach cramps let me know that something was happening. So now we're in about April of 2020. So a couple of months into the pandemic, and doctors still aren't seeing patients in person. And or at least that's what I'm assuming, because I'm terrified to go out of the house because I'm on immunosuppressants to begin with, or at least I was at the time, for my rheumatoid arthritis. So I was a little bit hesitant to make an appointment with somebody, unless I really knew that there was something happening. So eventually I asked one of my friends for a referral of who they go to, because my previous gynecologist passed away. So I made an appointment with this woman, and she scheduled me to have an endometrial biopsy as well as a cervical biopsy, and she also scheduled me to have a transvaginal ultrasound. So when I had the visit with her, and I kind of went through everything, she says to me, well, you should just have it in your head that it's cancer, so this way when it turns out to be, you won't be so surprised. And she says, but don't worry about it. She says, it's just in your uterus. We'll just take out your uterus and you'll be fine. Okay, so easy for her to say, but when you're on the other end of this and you don't know exactly what's happening, it's a whole other story. So, excuse me, I had all of the tests done, and after I had the endometrial biopsy, which was horrific. If you've never had one done, and God, I hope that nobody really needs to have one done, it's the most bizarre, uncomfortable, nasty feeling ever. You're completely awake for it, and it's just horrible. And I have a very high pain tolerance, and it was horrible for me. But anyway, I had that, and she never called with the results. And 2 weeks later, she had me scheduled to go back for a cervical biopsy. And I'm thinking to myself, well, I hope she tells me what happens with this first biopsy, because there's no point in her doing a cervical biopsy if I have cancer, because I know I'm going to have a hysterectomy. And just to kind of point things out, if you're younger, there are certain kinds of endometrial cancer where they can just do a D&C or do other treatments and keep your uterus in you so that you can potentially have children in the future. But when you're my age, they pretty much figure, it's healthier to just get it and take it out. When you're around the age of menopause, it's just like, we have to do what's best, and we're just going to get rid of it, which was fine. But anyway, getting back to the story. So I went the day of the cervical biopsy, and I didn't get unchanged, and she's kneeling down and waiting for me, and, kind of want to know what's going on. And I said, listen, I said, I want to know what happened with the other test. I said, what happened with the first biopsy? You never told me. I said, I don't want to have this done, for no reason. And she looked at me and she says, you have womb cancer. And I said, well, what kind? And she said to me, endometrial carcinosarcoma, excuse me. And I had already read up about the different types of endometrial cancer. And the most common type is adenocarcinoma, which is the type that is usually caught very, very early on, taken out, cured, that's it. And then there's two, what they call grade 2 cancers, which are clear cell cancer, and there's like 3 subtypes in that. And then there's the carcinosarcoma, which is only 2 to 3% of all endometrial cancers. It's very, very rare. It's usually not found until it's stage 4, and it's almost always too late to do anything at all. And I had read about the survival rate, and the survival rate was abysmal. So I knew all of this going in, and when she told me, I was just devastated because, excuse me, I was so afraid going into this that was going to be the end result. And unfortunately, that's what the situation turned out to be. So when I heard this from her, through all of my tears, I told her that I wanted a referral for an oncologist, and I wanted to go to Fox Chase Cancer Center, which is one of the top cancer centers in the area, and it's in my area, so I knew that that's what I wanted to do. My mom had gone to a local hospital when she needed treatment, and it was just a horror story from day one, and I vowed never to set foot in this particular hospital again. But anyway, I called, I got an appointment pretty much right away, and when the doctor at Fox Chase, Dr. King, when she reviewed all of my records and she saw what the results were, she said, at this point, we really don't know. She said, it looks like it might be very early stage. She said, if this is truly a stage 1 cancer, it's potentially curable if it's stage 1. And they always have to say potentially because they can't really give any guarantees or promises. But of course, they don't know anything until they actually go in and look. So I was scheduled to have a hysterectomy. I had the hysterectomy, and they removed everything, my uterus, my fallopian tubes, my ovaries, my omentum, which I didn't even know what an omentum was. And if you don't either, probably best to look it up, but it's some kind of tissue that covers your stomach. So she took that out, and then they looked at 15 different lymph nodes and, of course, checked them for cancer. And my CAT scans and everything had come out clear, and that was something else that I had known, before the surgery. So there was no evidence of a tumor anywhere. And, when the surgery was done, she said that it came back with clear lymph nodes, which was very good. She said that they did a pelvic wash and there were cancer cells in my abdomen. So I already knew, because of the type of cancer it was, that I was going to need to have chemotherapy and radiation as basically a preventative, so that if there was anything else that was floating around, the chemo and the radiation would kill it and get rid of it, hopefully. So anyway, she said, the lymphs look really good. She said, but there's one, we really can't tell if it's, a carcinous lymph node or if it's a fat cell. It's really difficult to say. So of course I'm in a panic, and I had to wait a couple more weeks to go back to her till they got all the pathology results back. And it turns out it was fine. The lymph node was fine. So I healed for 6 weeks after the hysterectomy. I was scheduled to go back in the beginning of August to have a chemo port installed, which they did. And then a few days after the port was installed, I started chemo. And I had one infusion, I forget if they call it cycles, rounds, I'm not really sure. I had one every basically 4 weeks, I'd say, because I would be infused and then I'd have so many weeks in between. I think it was 3 weeks to recover, and then on the 4th week you go back and you have another treatment. So I wasn't really that nervous about the actual treatment process because I had gotten infusions from my RA for like close to 20 years, different kinds of RA medicine. So I knew what happened when you go for an infusion, whether it's chemo, whether it's Rituxan, regardless of what it is, Remicade, Orencia, all of those. You go, you sit in a chair, someone hooks an IV to you, and you can watch TV, play with your cell phone, read a book, whatever for that time. And years ago, they had said, you know, when you watch a little video to prepare for the whole infusion process, one of the points in the video said, well, you know, you could use your time at the infusion as like your me time. And that's your time that you don't have to think about anything. You don't have to worry about anything. You know, you just go there and you sit and you relax for a couple of hours. Of course, it's much more difficult to do if you're being treated for cancer, but excuse me, my allergies are still horrific. And hopefully this weather is going to kill off whatever pollens are outside because my sinuses are a mess. But getting back to the story. So I couldn't have anybody go with me because of COVID, and I really didn't have anybody who would be able to go with me. You know, one of my friends had said that they would come if I needed somebody. And, you know, I kind of felt like there was no point to bring somebody, even if I could bring somebody, to sit with me in a chair for 3 hours and do what? To talk, to gossip. I could do that at home. I mean, I really didn't feel that it was necessary to occupy somebody else's day to do that. And I know a lot of people, the first time that they go, they're really scared. And I could really understand that. And I could understand if somebody wants someone with them the whole time. But for me, I just had it in my head that it was just another infusion. I knew what to expect, and I was fine with it. I never got sick from any of the treatments. I took something to eat every time I was there. I had lunch because it was a 6-hour infusion and I knew I couldn't go all that time with nothing. And they give you a lot of pre-meds. There's a lot of things now. So, you know, when you hear stories of people becoming really ill or that they were intolerant, it happens not quite as often now as it did in the past. So that's one good thing. And, you know, I was able to sit there the whole time. I was able to drive myself home. I'd come home, you know, tired from sitting in the chair all that time. But, you know, other than being a little bit tired, I never really got sick to where I was unable to do anything. The worst part of it was that maybe 3 or 4 days after my treatments, I would have this horrific joint pain. And that would last for maybe 3 or 4 days. And I'd say like by 1 week after my chemo treatment, I was pretty much back to normal. So I finished treatment in November, almost a year after this all started, and I rang the bell right before Thanksgiving. So this is going through a whole year. And a couple weeks after that, I had brachytherapy, which is basically internal radiation. And I'm not even going to get into the gory details of that. Thank God it was only 3 treatments. And, you know, luckily I didn't feel anything, but you know, it was like starring in a bad porn movie. Let's just say that much. I mean, if I could make a joke, that's kind of what it felt like to me. But I got through that, and by Christmas, I was finished all treatment. By Christmas, I had also lost all of my hair, and I had already been wearing a wig because I want to say like 3 weeks or so after my first chemo, I lost like 85% of the hair on my head, and it came off all at once. I was washing it, I pulled my fingers through, and it was just basically this big net of hair. And my hair was about down to my shoulder blades at that point, and I have a picture of the little hair pile that it made from, coming off in a big clump. It was not pretty. So I had to wear the wig because there was no way I was going to even go to my appointments and look sick. I didn't want to walk out of the house and look sick. I didn't wear the wig in the house at all because I hated it. And sometimes if I went to see one of my friends, I'd go and I'd wear some kind of a head covering and I'd be fine with it. But I didn't feel comfortable going out, and I didn't want to be stared at. I didn't want people to come up to me and ask me what was wrong. I just didn't. I think that it would have made things much, much worse for me. And I think that especially going through this alone, since I don't have any other family members at all, anywhere, it's just something that I didn't want to have like a big pity party. So for me, it was just better mentally to just carry on and be as normal as possible, not think about it, not talk about it, and just do what I had to do to get through it. So after you finish treatment, of course, you're always very nervous about what's going to happen with the next scan and whether you're going to find anything. And when I had my first scan after all treatments, there was a smudge on the scan, and they weren't sure if it was scar tissue or if it was a metastatic implant, and it was in my pelvis. So of course I'm going through a whole panic for another 4 months until I get my next scan. They did one 3 months later just to check up on it. And at that point, they agreed that it was just scar tissue and everything else was fine. I had no problems at all. My blood work was clear. I mean, my numbers and all are still off from having treatment, but I wasn't, at the point where I needed a transfusion, or my cat's coming to say hello. Hi, Tiggs. I wasn't at the point where, luckily, I was so ill that I needed to have transfusions of anything. And, that was one big saving thing as well. Generally, even when I went to the chemo appointments, I still looked really healthy. And a lot of times when they did the temperature checks, when you go in the hospital, they would ask me if I was an employee. So that just goes to show, when you're a cancer patient and you go to a cancer hospital and you look pretty good, they don't necessarily know that you're a patient, which is something else that I kind of wanted to point out, because not everyone with cancer looks ill. Not everyone with cancer is emaciatedly thin. I could definitely stand to lose weight, and I did lose weight before my surgery, and part of it was from the cancer. Part of it was, eating a little bit healthier, which, I overindulged during the treatment, but prior to, I was doing pretty good. And, I think that having a little bit more weight on certainly helped me, as far as if I had have gotten sick, I wouldn't have had the kind of reaction where I would be lacking critical nutrients. So that was a positive for me. But I never looked sick. By Christmas in 2020, all of my hair was completely gone. I had no eyebrows, I had no eyelashes. And by January or so, it started to grow back. Losing my hair really wasn't something that bothered me so much. I mean, it's something that I expected because only certain kinds of cancer, or certain kinds of chemo, excuse me, not cancer, certain kinds of chemo make you lose hair. You could have stage 4 cancer and you could have all of your hair. Having hair or not having hair is not at all a sign of how ill you are or where you are in your treatment. Not at all. For most people, it's a side effect unless you have alopecia for some other reason. It's not something that's caused by the cancer or, a sign of being ill. Once you stop taking the medicine, it takes so many weeks and your hair does start to grow back. And this is where I'm at now. And you can see I've actually got quite a lot of hair because this is only about 10 months worth, maybe. 11 months worth, and I've had 3 haircuts. Excuse me. I couldn't go like some people do and wait a year to get a cut because it was actually growing out and up, and it was just a mess. And it's wavy now. It was poker straight before, so that was a big change. But at any rate, I had clear scans from there out from April of 2021. And last week, I was able to get my chemo port removed. That was a huge, huge mental achievement, or physical achievement, and mental relief, I should say. And here's where it was. You can see. It's just a fine little scar. It's going to disappear soon. It really gave me the willies because you could see it and you could feel it. And if you moved a certain way, it just really creeped me out. So I'm glad not to need it. And I'm hoping that I'll never need it in the future because I don't have cancer. But that's my story so far. I managed to survive all of the treatments. I managed to survive so far a very rare, very aggressive grade 3 cancer. And I just want people to understand a few things. Number one, just because you go to the doctor and you have a clear pap smear means absolutely zero. It has nothing to do with your uterus. It has nothing to do with whether you have endometrial cancer or uterine cancer. That's just to test the health of your cervix and nothing more. Number two, I really didn't have any kind of outward signs that were huge red flags other than the abnormal bleeding. Absolutely nothing. I wasn't tired. I wasn't achy. I wasn't feeling strange. I didn't lose my appetite. My stomach wasn't bloated. There was nothing at all. I looked completely healthy. So there was nothing that really threw me off to know what was going on. So if you have any kind of abnormal bleeding, don't wait forever to get it checked. You need to get it checked, and you need to make sure that your doctor does a little bit more investigating other than just, kind of putting it off and saying, oh, this is normal at your age, or this is something that isn't so serious. If you think that there's something happening, you need to make sure that you get that information out. And likewise, if you go to a doctor like this crazy woman that I went to, who's willing to make you go through another test, a needless test, in order to put money in her pocket, which is, I think, what her plan was, that she would be able to bill for another biopsy and another office visit and collect from that. And in the meantime, she knew that I had this aggressive cancer and was willing to let me wait longer, which I was at stage 1B. And if it had gotten to stage 2 or further along in the 1B, I might not be in the situation that I'm in now. It may have already spread somewhere else because it spreads very, very quickly. So if you're in that situation, you need to go speak up for yourself. Don't listen to other people say, oh, well, the doctors know and they know what's best. No, it's your health, it's your body. You need to make the right decision and do what's going to help you and be good for you. The next thing that I wanted to just put out there is, if you get some kind of a diagnosis, don't Google everything that you can possibly think of, because you're never going to get all the information from Google. Google doesn't know you, doesn't know your situation, doesn't know your cancer. Although I have a cancer that has a traditionally low survival rate, most of the women who get this cancer are in their 70s, and they have other health problems as well. So it doesn't, and they also aren't discovered until they're at a much, much, much later stage. So even knowing that, it was very difficult for me to get it out of my mind. And I just made a decision that I wasn't going to use Google anymore. I wasn't going to look up any more information. The only information that I was going to take was from my doctor and listen to myself and worry about whether my treatment was helping me. And, lastly, don't ever underestimate how important and how dear your friends are, because my friends were just probably the best part of this whole experience. I would have never made it through without the help of each and every one of them, whether they came and stayed with me, drove me to the hospital, talked to me on the phone, gave me whatever support was necessary at the time. I just will never, ever be thankful enough or appreciative enough for everything that they did. And the other thing is, too, even if you're a proud person, you're going to need to rely on other people, because unfortunately, when I called, and there was a nurse navigator that was assigned to me through my medical insurance, and they asked if there was anything that I needed help with. And I said, medically, no, but if you're going to help me, figure out what to do here, I would like to know if there's any way that I could get assistance or reimbursement for a wig. And my insurance rejected me for getting the wig, even though my doctor gave me a prescription for a cranial prosthesis. I had to buy this ugly, ugly wig out of pocket. I didn't look around enough, and, that's kind of my fault. But for other cancers, you can get reimbursement. They would not reimburse me. Excuse me. Also, I had asked about housekeeping services or some other kind of assistance, one day a month or whatnot, to help with some household tasks, if there were any kind of organizations, which I would have been willing to pay for, who could do that. And they said no, they don't have any of that. And again, there are cancers where there are so many resources, and for somebody who's going through an endometrial cancer, it's not there, or uterine cancer. I don't know even if it's there for ovarian cancer, which is also very serious and very, very deadly. And I don't mean to put anybody down, and I don't mean to, rank things on any kind of a list, but there's so much awareness for breast cancer. There's so much that's out there, and so many different resources for breast cancer patients. And unfortunately, there's not those kind of resources or awareness for these other types of cancer. And I think that that's a shame, because you know, if you're having major abdominal surgery like I did, I really had to rely on my friends to come over to the house to vacuum for me or to carry something up and down the stairs because I wasn't physically able to do a lot of that for quite a few weeks. But anyway, for anybody who's watching, I'm going to end this video now, and I'm going to end it again on a high note. So far, I'm a survivor. I plan to be a survivor. I don't want to come back to this topic again, but I do want to do at some point a luxury self-care video. But I hope that you take the information from this video and share it with any woman that's important in your life, whether it's your sister, your mother, your cousin, your friend, whoever, and help them to become more aware and, you know, to just do what they need to do and be aware so that they're not in a situation where they're going to endanger themselves and go for a long time with this potentially deadly cancer growing in them. Yeah, so that's it. And don't be afraid of the treatment. The treatment is going to help. It might not help everyone, but it does help many, many, many people. And it's not like it was years ago. So if you hear people say, oh, well, you know, it just makes you more sick and the chemo kills you and this and that, unless you're really very, very ill to begin with, you're going to get through it. You have to have faith that you're going to get through it. And just having faith in general in your higher power, whoever your higher power is, in your friends, your family, and yourself, you could do it. And please offer support to anyone you know who's going through it. All right, I've talked long enough. I hope that this was at all helpful. I really appreciate your listening. And again, please, please share the information with anyone in your life who really needs to hear it. Thank you.